Dr. Kevin Kavanagh is a retired physician. He is also founder of a national organization, Health Watch USA, and he is our go-to guy. He's our Dr. Fauci, and we appreciate him very much, Dr. Kevin Kavanagh. Good morning, sir.
Good morning, Jack.
I mentioned Dr. Fauci. He told Congress that the United States will be doing more testing, not less, as the coronavirus continues to spread across the United States. You know, President Trump made a remark the other night. I told them to slow down on the testing or something of that nature. And Dr. Fauci said yesterday that, to my knowledge, none of us have ever been told to slow down on testing. It's just a fact. In fact, we'll be doing more testing. Then someone from the White House said the president was just kidding when he made that remark. And then later the president said, no, he wasn't. So whatever. But we're not slowing down on testing, the bottom line, right?
Absolutely not. Testing is key. And the thing that drives me so crazy is that if you test enough, your cases go down. You test primarily to get rid of the epidemic. Now, I mean, of course, you do want to know how the epidemic's going, and testing's important for that. But the main reason to do testing is you can do case tracking, identify people to stay at home and do self-isolation. And this, after a couple of weeks, will start to drive the rates down. And the problems you have now with comparing countries between the United States and other countries is that other countries have such a low rate that they don't have to do as much testing. So we are in a hole on the testing. It makes about as much sense as, well, it's similar to my weight loss program at home. I'm not gaining weight, but then I'm not checking the scale anymore. It makes no sense.
Yep, I agree. Now, remember back when we first started closing down and having people stay home, and it seemed to us anyway that Tennessee was still, people were going across the border from Kentucky to Tennessee to eat in restaurants, and they were much more lax. Well, I understand that it's paying off now. We have 302 cases per day in Kentucky, and they have 750 in Tennessee.
That's correct. They're taking off big time. They have also increase in the number of hospitalizations. So again, this is not due to testing in Tennessee. I have a very good friend in Memphis, Tennessee, who's a physician, and he tells me that the rates there are going up. They're seeing significant amount of very, very sick individuals. He states that, once you're in the ICU, you're in trouble. And that in Memphis, Tennessee, they're considering backing off on their opening up. And so it's a problem. And it will become a problem in Kentucky unless we also start following masks, not congregating in bars, and doing things wisely. I mean, this is something we're going to need to learn to live with. People will say, well, you learned to live with polio a long time ago. What's the difference? Well, the difference is when there was polio season, people did things differently. If you talk to some of the older people who lived through polio season, they'll tell you they weren't hanging around in large crowds. And polio wasn't a respiratory virus.
And before we pat ourselves on the back, I understand the USA has the highest number of cases per day of all time.
That's correct. We had over 35,000 cases. Could some of that be due to testing? Well, yes, because we're not doing very comprehensive contact tracing at this point. But compared to the European Union, we are much higher. They're down at 4,000 cases. We're up to 35,000 cases per day. European Union actually has a greater population than the United States. And the depressing thing there is that the news media yesterday was just a buzz of the announcement that the European Union is considering putting a travel ban on the United States because we're doing so poorly.
Texas is doing particularly poorly, and I heard I believe it was the mayor of Houston yesterday say that they're headed to be maybe the new epicenter in the country.
Well, they're in a head-to-head race with Arizona and Florida. That's correct. And the governor of Texas, and as you can remember, he was a staunch kind of anti-public health advisement person. He has converted and has warned his population that There's never a reason to leave your house unless you have to go out. So he's a convert. Likewise, the governor, Doug Ducey of Arizona, during the large Trump rally yesterday where they weren't wearing masks, probably spreading the coronavirus, Governor Ducey was wearing a mask. He was, I think, the only one there, but he also has now allowed the mayors of the cities of Arizona to decide whether or not they should wear masks. Phoenix, it's now mandatory, as is Scottsdale and a number of other cities. So these individuals that were staunch personal freedom, we shouldn't be forcing this on people, kind of a President Trump type of a dialogue that you were hearing, well, they're become converts now as this infection has started to wreak havoc on their populace. And you're also starting to hear more about the problems of if you're in the ICU, people talk about being recovered. You're not really recovered, you just survived the onslaught of the virus. You still have a high likelihood of having to obtain medical care and being chronically sick. So you really do need to treat this virus seriously.
All right, sir. Always good to hear from you. This is what is this, Wednesday? We'll talk to you again on Friday morning at 9:30. Thank you.
All right, thank you, Jack. I appreciate it.